Hello, everyone. Welcome to another Calibration Marketing webinar. Today we have a great guest, the CEO of Aether Biomedical. And if you've been saying their company name wrong all along, you are not alone. So we'll talk about that in a little bit, talk about their startup story, a little bit more about the Zeus hand, and kind of how they have really penetrated the US O&P and upper limb market. But before that, just a quick intro on calibration marketing. We are taking new clients. Calibration marketing was started by myself after a little over 8 years in the O&P industry. From a marketing and product and go-to-market standpoint, I started my own entity. And the goal and purpose of it is to offer marketing, product, go-to-market services to smaller companies, clinics, manufacturers, whatever the need is, those services. There's seemingly a gap to be able to perform these types of tasks often, especially if you're a smaller entity in a smaller clinic. It's just another thing to have to worry about. How am I going to do my social media? How am I going to get my story out there? How will I grow my referral list along with everybody else that's out there? So the purpose is to kind of alleviate you and take that burden off of your shoulders and provide you ad hoc services for marketing support, whether it be on a project basis, part-time, sometimes larger scale projects. So whatever the need is, if you'd like to check out calibration.marketing, that's the website, and you can learn a little bit more about what I do, who I've partnered with in the past, some of the work that's been done, as well as some really great downloadables about the O&P market. I have a couple of quarterly market updates, as well as some upper limb information that hopefully you all will find interesting. But without further ado, I will add and welcome Dhruv from Aether Biomedical to the stage. So thank you for taking some time out today. I know you're overseas. I'm on the East Coast. You're in Poland. But if you could share a little bit about who you are. Obviously, many of us that are maybe listening are from this market, but there are others that haven't heard of you guys, don't know just the upper limb landscape, and have found themselves in this, have been thrown into a situation, are trying to understand more about what the options are. And before we kind of get into the nitty gritty of the product offering, if you could share a little bit more about yourself, kind of how you guys got here, and why Aether and the Zeus hand.
Yeah, perfect. So first of all, thank you for inviting me here, and thank you everyone for joining. As Linda said, I'm Dhruv Agrawal. I'm the CEO of Aether Biomedical. We are a company primarily based out of Poznan in Poland, with a subsidiary in the US and another subsidiary in India. Team of nearly 50-ish people at this point.
Great.
Have raised close to $15 million in terms of private and public capital. As a company, we started back in 2018. Seems like a long time ago.
But also like a blink of an eye, I'm sure.
Yeah, absolutely. But since then, we have already gotten to a point where we have shipped close to 600 devices at this point, especially starting from 2022, in terms of the shipping of these devices, specifically the Zeus hand. My personal background is in medicine. So I grew up in India. I come from a central part of India, a state called Madhya Pradesh, but then I went to New Delhi to study medicine. My co-founder, Faith, we actually met during our days in high school, and luckily ended up in the same medical school back in India. But when we were in that medical school, both of us realized that we were much more into the technological aspect of medicine rather than the clinical side of it. So started experimenting with various things. And in the meantime, my dad gifted me a 3D printer, and that's where the story of Aether essentially begins.
No, that's great. And, we've obviously run into each other a number of times at trade shows and things like that. So, but it's always interesting to see kind of where everybody starts and what the drive is behind these great technologies. And I know you've been on some of my other previous webinars as well, just to kind of talk about your technology, what the Zeus hand offers, how it's different, because there are a lot of different options. But most recently, at the beginning of this year, you actually had an opportunity to do a TED Talk in Poland. And some of what I'm trying to talk about during this summer series of manufacturer webinars is, when possible, trying to peel back the onion on the startup journey, because it's very easy to give up, right? Because it's not an easy one, ever, or typically, and especially in a oversaturated O&P industry, and specifically in upper limb prosthetics. It's a challenge when you're trying to enter new markets, start a new business, enter new markets, trying to service different users. And while surely there are a lot of similarities to what you may get in terms of feedback from users and what they want, the nuances for all of those markets are very different at times. So I would love for you to be able to share a little bit of what you shared during that TED Talk, of what you've learned so far during your startup journey of Aether, because many may have missed it. And I think I found it very interesting, because there are a lot of learnings, and especially for those that are trying to enter this market, I think there's a lot of great takeaways.
Yep, definitely. I mean, one of my favorite quotes is, "It takes a village to raise an entrepreneur." I have that quote, and I think that holds true very well. Talking about Aether, we started back in 2018. It was just me and my co-founder, two 20-year-old kids who had just dropped out of medical school back in India and were trying to figure out what to do next. Things have changed a lot since then. And of course, we made a lot of mistakes along the way. So, for example, after we got this 3D printer, we started looking into various open source projects on just purely out of curiosity. And prosthetics was an area that we were always drawn towards because of the potential that it offers, and the value that you can provide to the patient by giving them a device that can help them go back to their work, that can help them lead a better life pretty much straight away. And so we were always interested in prosthetics, but we had no clue of what the market needed. And we were gullible / naive enough to just look at pure headlines from some of the news that you read on a day-to-day basis about prosthetics costing $1 billion or some crazy ludicrous amount of money. So initially, when we started building bionic hands, or the initial sort of motto of this company was to make a hand that is 100 times cheaper than some of the alternatives that are on the market.
That's everybody's goal. We can do it faster, cheaper.
Exactly. And that was the goal that I and Faith started with, 6 years ago or 7 years ago. But the very important thing was, as we matured as founders, as well as the company matured, we kept looking at real pain points to solve. And we sort of went from hypothetical pain points that we thought were true versus market-driven pain points that we understood as we got closer and closer to the market. So even when we launched our product for the first time in 2020, that product should have never been launched because it was just not ready, and it did not had a single unique selling proposition which solved a core problem in the market. Whereas the product that we have right now, it solves many of those key fundamental problems that exist in the market, and we missed out on all those problems on day one of launching the product. But as we got closer to learning more and more from the market, feedback from patients, feedback from clinicians, we maintained flexibility within the organization to have those feedback be incorporated back into the product as we continued building this company. So we got to a point at some stage around end of 2022, beginning of 23, where we had a product that solved some of those core problems in the market. So I would say the key thing is to it's okay to start with a completely wrong set of problems to solve. It's much more important to be flexible enough to continue to listen to the market, to continue to try to get down to the core issues, the root causes of the issues that are faced either by the clinicians or by the patients, and try to incorporate some features in your product that attack or solve those core issues.
Yeah. And can I ask, when you launched that hand, was it a global launch, or was it a local launch in Poland or in India first, and then hoping that you can just take that same product and bring it here? And that's part of when the realization came, oh God, okay, well, for the US, we need to address some key things.
No, it was very much like the later that you say. We had this launch in Poland and India because we are a company based out of Poland. We are from India, and we have a network of contacts over there as well. So initially we started in Poland and India, didn't get a lot of traction. So ended up taking the market rather than our own product for that lack of traction. So decided that we're going to try out the US market next. Entered the US market while the traction still wasn't there. Of course, we were improving the product in the meantime, tried a few other markets in Europe as well. But as we continued to see a lack of traction from multiple different markets, we switched our thinking from the problem is not with the market, the problem is with the product that we are trying to force into the market. And that's when we started looking at, okay, what are the real problems that our product today solves? And there was very little that we had to show for. And at that point, we started looking at, let's go back to the drawing board and try to understand all the work that has been done up till now, all the problems that have been left unsolved, and what additional work needs to be done on the product to solve those unsolved problems and to create that unique niche in the market. So, for example, one of the most loved features about our product right now is local level repairability, which is huge. A clinician in the US market, or any market for that matter, can repair the device in 15 to 20 minutes, irrespective of the problem that happens within the device. And this was not a feature that was present in the product at the beginning when the product was launched. It was the realization that we got when products broke and came back to us, and we had to hear the frustration from the customer about why is your product breaking.
Right. Yeah, no. And I guess that leads me to another question before we jump into more about the Zeus hand. When you came to this realization, and I talk about this a lot, that oftentimes, especially in a new startup that has, whether they've proven success overseas or not, typically the first step is to just get somebody in sales and just sell this thing. And obviously, as that likely started happening, you started to get those products back saying, like, what is going on here? These things are breaking. You need to do something about it. So as you started to tiptoe into the US market, what were some of the areas that you were focusing on initially and realized you need more support for as you are, as to where you are now with all of your clinical support and things like that? Were some things overlooked when you were first kind of let's just jump into things?
I think one of the biggest learnings from the US market and our launch and our work in the US market has been how important providing good customer support is to the clinicians. It seems like a very simple thing. It seems like such a natural thing to say. Of course, we provide great customer support, but to be able to break down what customer support is from qualitative metrics to quantitative metrics, which is the number of minutes it takes you to respond to a clinician's call, the number of hours it takes you to solve a problem for a clinician, the number of days it takes you to get a problem, do a root cause analysis, and then provide feedback back to the clinicians. These are all qualitative or quantitative customer support metrics that we were not really tracking in the past. But as we as a company matured and as we learned more and more from the US market, we realized that this is a very overlooked area, which irrespective of the type of the product that you have, if you're able to complement that with great customer support, you will be able to build champions of your product in the market. And that has been, I would say, one of the areas that we overlooked at in the beginning, but are getting significantly better at as we speak.
Yeah, no, and I think it's that's always been my focus as well. That the product is one thing, but it's what happens after, and also throughout. How do you support that clinician and that user so that they feel comfortable, and then what happens when they take that thing home? And I think it's incredible that you're addressing those areas. And I know obviously on LinkedIn, and share whatever you feel is necessary to talk about, but I feel like it's a positive for you guys to address that and recognize it. And it's been, I don't think it's any industry secret that you guys did partner with New Tech Synergies to be able to add some of that support. And I think it's important for startups to recognize that it's not all about sales. You have to have that additional support. And it's also 100% expected that you may not be able to expand your team from 0 to 10.
Yep, absolutely.
But how will you do that? Whether it be through, a partner like New Tech, or somebody like Hanger with what they're doing, or somebody in the industry that can provide you with that guidance and that extra layer of support, so that it's not just about, well, we have a great hand.
Yeah,
that's great, but then what?
Yeah, that was the main factor behind why we decided to partner with New Tech, and why we are building some of the other partnerships that we have in the US, is exactly having that realization that we have got a really solid team in the US. Now we need to provide them with the right support structure for them to deliver the best possible results for us as a company. And that was the decision making, the factor behind that particular decision making.
No, I think it's very you're definitely acting very forward thinking and recognizing where some of those areas of support are that you need, and addressing them, rather than just saying it'll be fine. It's going to work out. The sales will be there to support it. But is there anything else from a startup perspective that you want to share? Well, otherwise we can jump into a little bit more of the product. I know you have some of the demos with you, and kind of showcase how quick it is to fix a finger or the hand, which is something that you talk about a lot in your marketing. And is, as you said, a large area that you guys focus on to make sure that it's, as somebody that would have marketed a product that may have competed with you, that local repairability and quick access to be able to repair something is such a huge difference maker for you guys. Absolutely. And to be able to make it so much simpler for a user to not only address that, but also be able to talk to their clinician remotely and be able to figure out what the issues are and fix them without having to drive 2 hours. I know in some of the brand ambassadors that you guys have that I've talked to have said that's a game changer for them. Definitely. And they may hear otherwise from other manufacturers, or from other users, my hand's always breaking. It takes forever to get it back. And in their case, it's, it'll come out in the article, but Lizzie Smith, one of your users, was saying like, that's just not her experience. It's always been very seamless. And as a completely new user to prosthetics, that's a great thing to have in your back pocket, to be able to tell that story.
Yeah, definitely. I mean, the local repairability bit, I think, is where the industry should be moving forward towards. I see that there are a lot of other companies that are also looking into that. So that's of course great news, because there was actually one paper that I read from NHS which found out that on an average, prosthetic hands break about 3 times a year, specifically talking about bionic hands. Every single time they break, it takes about 6 weeks to get them repaired. So if you do a basic back of the envelope calculation, that means for a 4.5-month period, in a 12-month period, the patient does not have access to his own hand. Yeah. And we wonder why this industry has such high dropout rates. So you're going to have really high dropout rates if you constantly are switching between using no device to going back to your hand to using no device again. And even with the provision of a loaner, the problem of having to go back to the prosthetic clinic, having the loaner set up with the software platform again, it still is not going to feel the same as your current hand feels.
Oh,
There
100%.
are problems that exist.
Yeah.
And same was the rationale behind the software platform as well. Like a lot of times, the amount of effort that it takes to get a patient, solve a patient's problem is not that high, especially when we are talking about basic issues like, in their day-to-day life, the thresholds might need to be adjusted a little bit, or the gain might need to be adjusted, or some fingers in terms of some grips on how a tripod grip comes or a pinch grip comes, how some of these things might need to be adjusted a bit. These are 5-10 changes that people have to sometimes drive for hours, and at some point they would rather give up on using that device than to regularly go to their clinic for a small 5-minute 10-minute change.
Right.
The rationale behind the remote configurability as well.
Oh, 100%. No, I think it's definitely a game changer. And I agree that, part of why I like to do these webinars with manufacturers that may see themselves as competing, but it's something that we talked about on the last webinar that I did with LindExtend, is we all need to constantly be driving each other towards greater innovation. So like in my mind, I never see another product as competition. And that's why the first time that you came on a webinar with me was when I was working at Brain Robotics. Yeah. Like to me, it's more about that collaboration. And of course, everybody's going to, have some sort of unique benefit or unique feature. But at the end of the day, if you lose a sale or Oster loses a sale or, Bion IT, it's not about, sometimes it's about, it's a sale that's lost, but oftentimes it just wasn't the right product. It wasn't the right user, or the clinician wasn't trained well enough. Yeah. And that's okay. And that's why there's space for all of these different solutions, and the right users and the right products will come together at the right times. So without further ado, I'm going to throw this presentation up just so everybody can see it. And you drive and kind of tell us a little bit more about the Zeus hand. How is it different? Who is it for? And what can people expect? Yeah, and that's a great start off question. Why do we need this?
So that was exactly the question that we asked ourselves at some point in our startup journey, on why build another bionic hand. And this next slide regarding the reasons has gone through multiple iterations over the last 6 years or so regarding what we see as the main problem in the industry is. But this is what this has been our sort of learning over the last 6 years, when we really drill down the need for another bionic hands into its simplest possible terms. What we see is that current bionic hands are extremely weak in terms of their grip strength. So especially when we are talking about something like a power grip, where patients have to grab something.
I'm going to hide this for a second so they can see it better. Yeah.
So something like a power grip, where somebody has to, use some kind of, heavy duty equipment, or just carry bags, or even for simple activities like have a tightly closed jar and open it. These are things that require significantly more amount of force than what we are able to perceive in our day-to-day life as able-bodied individuals. So the first thing was to make sure that we are able to solve these problems of bionic hands being very weak and patients having to go back to their single action device or their electronic terminal device to do any kind of medium to heavy duty activity. We already talked about the fact that bionic hands break a lot, but then a much bigger problem than that is what happens when these devices break. And the current situation, unfortunately, is that it takes forever to get these devices repaired. And then finally, the fourth problem, a little bit on the software side, is that these devices have no integration with the digital ecosystem that we live in today, where we talk about smart TVs, smart thermostats, smart whatnot, everything smart except prosthetics. So that's those are the 4 key problems that we wanted to solve with our product. And that's why we launched Zeus, which is at this point the strongest bionic hand in the world in terms of its power grip force or its grip strength. The key features that we talk about, again, we don't really talk about X number of grips or all of those kinds of things, because The key features that we talk about are purely related to the problems that we have identified. So it's a strong, robust, locally repairable hand that is also remotely configurable. So going back to the basics about what do people need? People need something that they can depend on. People need a device that they can trust, and people need a device that they can use without the fear of breaking it. One of the things that we always try to tell new amputees is, when they are trying to use a device, when they get fitted with this Zeus hand, we try to drill down this thought process of, do not be afraid of breaking your device. You breaking your device, unless it is within a certain parameters, of course, we're not talking extreme cases here, but you breaking the device in day-to-day activities, in general use cases, is not a you problem, it's a me problem. It's up to me to solve that problem, not for you to solve or think about how do I use the hand so it doesn't break.
Right.
And that's
it also means that they're using it, right? At least it's not sitting in a closet, and they're actively trying to make the most of this and have an experience like those of us with two hands to be able to do those bimanual tasks.
Yeah, absolutely. So that mindset shift is very important to promote amputees to use the device, to actually use the device. And that's why we have this local repairability. So in case you break the device, you always have an option to get it fixed right away.
Right. Yeah.
And then is the remote configurability, which allows clinicians to connect with a patient's hand completely remotely, where they're able to talk to the patient, they're able to look at their device, they're able to look at their muscle signals completely remotely as well, and make any changes in any parameters of the prosthetic device right from their clinic while the patient is sitting in his home.
Which I think you and I went back and forth a little bit on this when I wrote that article with Carl and Susie about upper limb prosthetics, about remote configurability. And at the end of it, I was like, okay, no, you guys have it nailed down 100%. And I started adding asterisks to everybody else, that it's obviously with today's technology, I can FaceTime you from anywhere and we can address this. But when it comes down to making these types of changes and updates truly remotely from anywhere, that's a huge difference maker. And I think it's a very big reason why I'm certain a lot of your users don't feel that angst of, okay, now this thing is broken. Yeah. I don't know how long it'll take to fix it, or I just don't know what could be the matter with it. Now I have to drive 2 hours, or if I'm traveling globally, there's nothing I can do. Yeah. So I think it's a huge game changer.
I mean, our simple philosophy has been, the prosthetic device should not be an additional burden to the patient. It should be a support. It should be a supporter of the patient. It should not be an additional thing that they have to worry about, that they have to think about, that they have to carry around as a burden. So that's right. Really the key mantra sort of that we use when building products, building features, is what allows us to further unburden the patient's experience with the use of the Zeus hand and accompanied components.
Yeah, no, I think that's those are the true features, as you said earlier, that really make a difference. And I encourage, if anybody that's listening in, go ahead and drop your comments or questions or anything that we can address while we're live here. But from a repairability standpoint, if you could talk through that a little bit. I know that's another big area that you guys focus on when telling the Zeus story. If you could show us or, talk to us about that a little bit.
Yeah, absolutely. So from a repairability perspective, we essentially divided the hand into 7 modules. So it's a modular design where the clinician can locally repair any device that they, or any component within the device that might have broken. And so on the video, I can actually quickly show you what that looks like.
Let me hide this. There we go.
So in the hand, there are basically 4 screws on the back, 2 over here and 2 in the bottom. There are 2 additional screws on the wrist side. And once you open those 6 screws, everything can be done using a simple single torque screwdriver. So we even got to the point where we made sure that every single screw in the hand that a clinician has to open. They don't really need a toolkit for that. They just need one screwdriver that they get along with the Zeus handbox as well.
Awesome.
Once you get rid of those 6 screws, you basically are able to open the hand like this. So you have access to the entire internal structure of the hand, and whatever finger you need to repair, you just have to open another screw and push that particular finger out. So you just take that finger out, take it out from the circuit board over here, and whichever finger you need to repair, you put a new module in, just make that particular connection, just connect that to the circuit board. And once you have made the connection, you can just put it back together. So that's how easy it is to essentially repair the finger. Of course, if you have to repair the circuit board, you can just same process, open the hand, take the circuit board out, 3 screws for the circuit board, and put a new circuit board in. If you need to repair a thumb, you just take all 4 fingers and circuit board out and put it into a new thumb module. So there's only 7 modules. There are finger modules, there is the thumb module, the circuit board, and the back plate. That's basically it.
So do you encourage clinicians that do partner with you and have users that utilize the Zeus hand, do you encourage them to have almost like a repair kit that they also purchase as part of it, or just kind of wait until if and when something happens?
So it depends on the preference of the clinician. Generally speaking, we keep all of our spare part inventory in the US in Chicago, and we can basically overnight anything to the clinician. But if it is somebody that has a lot of upper limb cases and they do a few fittings a month, in that case, we prefer to just provide these spare parts upfront to the clinician. There is no additional charge for these spare parts. So we just provide it according to the number of devices that they have fitted, so that they have a minimum level of inventory at their workshop.
Okay. So yeah, and as you showed, obviously you don't need to be an engineer or a technician to be able to do these updates. So that was going to be one of the things that I ask of, and I think it's something that you and I have talked about during our run-ins at AOPA and all these different shows of, is it something that is welcomed by clinicians to be able to just take this on themselves and quickly fix it? Or obviously, if you're a super user, maybe just doing it yourself as approved by your clinician, or do they prefer to send the device back to you guys in Chicago and just say, I don't know what's happening here, help me fix it? Or obviously, I'm sure there can be a bit of a back and forth as well.
Yeah. Based on data, I mean, at this point, we have already fitted, I would say 120, 130 devices or so in the US.
Okay.
And based on the data, till this point, we have gotten maybe 2 requests, if I remember correctly, where a clinician said, I would rather prefer to send the hand back to you. And that was purely because there were multiple things within the hand, like the thumb and 2 fingers, something like that. So there were like 2 requests, if I remember correctly, where the clinician requested that the hand be sent back so we can do a proper evaluation. But in
that's minimal.
most of the other cases, the clinicians have absolutely loved the possibility of, I don't need to send the whole hand back, have a loaner fitted to the patient, send the loaner back, get the other hand back, and do all those kinds of things. You overnight the module, the patient comes in tomorrow, and I fit it, I fix it, and I send the patient back home.
Right. No, that's definitely speeds things up a lot.
Yeah. It even has to be the prosthetist. It can be the technician. It can be the support staff in the clinic, because this is something that a 12-year-old can do or a 13-year-old can do. There's no rocket science behind the repairability of the Zeus hand, because what we are saying is we are not asking the clinician to diagnose the problem. I'm not saying to figure out, is it the motor that is not working? Is it the gear? Is it the plastic part? Is it the aluminum link? What part is not working? That's not your headache. From your perspective as a clinician, the finger doesn't work, you take it out and you put a new one in, irrespective of the problem that has happened. It's for me to figure out what the problem is, not for the clinician.
Yeah, no, I agree with that 100%. I know we're a little bit over time, so I want to kind of give you an opportunity to share if there's anything specific that you feel like comes up a lot, or questions that maybe you feel like aren't addressed enough, or areas of whether it be the business or the product itself, or if there's anything looking ahead to AOPA that is worth teasing that you guys are working on. I'm sure that there's always some iteration going on because obviously as a startup, it's much easier to, as you said earlier, to listen to the feedback, iterate, and be able to come out with updates quicker than it is if you're a larger organization, because there are so many different things to keep track of and consider. So the floor is yours before we wrap this up.
No, absolutely. I mean, one of the most exciting things that we're working on right now is the second version of our product. This Zeus version 2 is going to be available in a smaller sizing as well.
That's great.
been one of the key areas that we are working on. So if you want to just compare in terms of sizing, I would say it's about 30% smaller than the current version that we have in the market right now. So similar to how the Bionic small or the iLim extra small or some of those other devices are. And of course, in this, we are further increasing the performance capabilities of the version 2 with an increased speed on the hand, even having the similar grip force, even after being a smaller sized hand, and a few other features that we will be adding to the version 2 as well. This is something that will most likely have a prototype to show at AOPA, and then likely be looking to launch towards the mid of next year in the US market.
Yeah, certainly don't rush the process because, as you know,
I've learned that already.
Yeah, most of the exciting stuff comes after, right? But most of the time is spent in the shop making sure that it's actually viable and the right solution and not just a Band-Aid and a quick fix.
Yeah, absolutely.
So I'm sure everybody's going to be thrilled to start to try out those new features and the smaller size, which, you know, is always a comment, especially for those smaller, you know, users that are looking for a solution. But before we wrap here, I'll just add in that, you know, we are into our summer webinar series, with Aether being the second one. We've got OSER coming up next, later this month, actually, and they'll be talking about partial hands. So kind of taking a shift from the full hand from an upper limb perspective to partial hands and that market, which is significantly larger than full hands and amputations. So we'll be talking about everything that they have to offer from a myo to the naked prosthetics standpoint. But Dhruv, before we end, anything else that you want to add before you go? Certainly people can find you on LinkedIn. They can find you guys online. I know you guys have videos everywhere, but anything that you want a user or a clinician to know in terms of how to get a hold of you guys?
Yeah, no, I mean, the main thing that I would add is at any point, feel free to reach out to the Aether Biomedical team or the New Tech team to get your hands on a demo unit. We have a decent supply of those in the US market, and we are constantly increasing that number as well. So we want to make sure that whenever you have a patient that wants to try out the Zeus hand, we can reduce the effort that it takes for you to get the device and try and test it out with the patient. So feel free to reach out to our US team, to Sarah, Tom, and Ryan, as well as to the New Tech team for any sort of demo requests that you might have, or any deep dive requests that you might have for the product.
No, that's awesome. It's definitely been a pleasure. So thank you for giving us some of your time today. I know it's the beginning of a whole new quarter, so I'm sure you'll crush it again. And be sure to visit Calibration Marketing online at calibration.marketing, as I shared. And I hope you'll tune into our next webinar, July 25th with OSER. But with that, I will say adieu. So thank you, Dhruv. Thank you, everybody, for listening in, and we'll see you soon.
Thank you.